Hi, my name is Dr. Ranj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video we're going to talk about how to treat dehydration. Now, dehydration is a term used to describe where the body's fluid stores are depleted. Sometimes it can be very mild and occasionally it can be so severe that you need hospital treatment. Fortunately, there are some things that you can do at home to start off the treatment yourself. Dehydration happens because either you're not taking in enough fluid or because you're losing too much, for instance, if you're vomiting or if you have diarrhea. Warning signs in adults include feeling thirsty or lightheaded, passing dark urine or not passing very much urine. Warning signs in children include a sunken fontanelle or soft spot, lethargy, tiredness, not passing very much urine or less wet nappies, and reduced tears or sunken eyes. Treatment of dehydration not only involves replacing the fluid that you've lost, but it's also important to replace the salt and sugar that goes with it. Fluid replacement is the most important part. Solids can be reintroduced later if that's appropriate. And we're going to go through some of the general measures that you can do at home to try and treat dehydration yourself. Number one, make sure you use the right fluid. Now, the fluid cannot just be water and ideally should contain sugar and salt as well. Oral rehydration solutions are ideal for this. In small children, because the rehydration solutions don't taste very nice, you can flavour them with a bit of juice. If your dehydration isn't that bad and you're able to drink and eat, then you could have sips of sugary fluid and have salty snacks as well. If you have something like vomiting, it may be a good idea to try and drink small amounts frequently. For instance, in a child, you may start off with 5 ml of fluid every 5 minutes and build that up over the course of 24 hours as they tolerate it. Luckily, there are other ways of getting fluid into children. For example, things like ice lollies, jellies and ice cream is a really good way because they have such a high water content. Especially in children, solids aren't that important. The fluid is the most important factor, and solids can be reintroduced again when they're feeling better. If you are dehydrated, it's always a good idea to avoid caffeinated or alcoholic drinks because they have the potential to make you more dehydrated. It's important to know when to seek help in dehydration. For example, in babies and small children, if you're not getting any better, if you're not able to keep anything down because of vomiting, or if you're elderly, then it's always important to seek help from your doctor.